Hi, I'm Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor. Our website is thenutritionalhealingcenter.com, and this video is a quick video on heart tests and how to treat nutritionally some heart conditions. And this is fantastic information. So there's 4 blood tests. These are all blood tests that you can run that are very, very important. And the key is medical doctors don't really run these because there's no there's no drug solution for these. Only nutrition can fix these 4 problems. The first one is called lipoprotein small a, lipoprotein little a. This is 10 times more important than LDL, which you know about cholesterol, LDL. Everybody knows about that because there's a drug to reduce that, but there's no drug to fix this. And the way that you fix this is you eat saturated fat, number 1. Number 2, ginkgo, the herb ginkgo, in high doses, at least 3 grams per day. Not milligrams, not 300 milligrams, 3 grams, which would be 3,000 milligrams. So a higher dose has got to work. It's got to be good quality ginkgo. And then, of course, no sugar. You got to get off the sugar, get off any sort of refined carbohydrates. So next one is fibrinogen. This is a clotting factor. All of these cause clotting. Back to this lipoprotein A. This clots up so fast. You can have clear arteries one day and then a week later have a heart attack because one of the arteries is 90% blocked. This clots really fast. It's very important to know this is 10 times more important than LDL. So fibrinogen and C-reactive protein. This is a clotting factor, and this is a marker of inflammation. These both go down with a supplement that we have called Cataplex ACP, and it's a great supplement for reducing inflammation. I call it the duct tape of healing supplements. You can find equivalents elsewhere, but I'm a huge fan of that one because I've seen that work. I've seen that get rid of chest pain, and the breathing gets better, and the chest pressure and heaviness goes away. So Cataplex ACP, it's from a company called Standard Process. That's our favorite supplement company. Lastly is homocysteine, and that's related to B vitamins, folic acid, but all 4 of these, it's important to make sure your diet is really good. And they could be high because of genetic factors, like if your parents both had heart attacks in their 40s, or your dad died from a heart attack at 50, and then your grandfather. Those genetic factors can still be reversed by doing it nutritionally. So we can run these in my office. The charge is $139. I have a patient with high lipoprotein A. She goes to University of Michigan Hospital. They draw the blood and they send it to the Mayo Clinic because that's where it's such a specialty that at the whole U of M hospital, they don't have any answers for it. That's because it's nutritional. All right, now I'm going to talk about unstable plaquing. There's a condition where here's an artery, and you have this plaque build up over the course of years and years and years. And most of the plaque is made of a solid formed plaque that just won't move. But over the course of years, it causes trouble. It gets bigger and bigger. It clamps down on the volume of the blood going through. But it's not going to let loose and break free and cause a heart attack. The unstable plaques are a small percentage of the total amount of plaquing that can occur in the arteries. And that would be more diverse in the ingredients, if you will. So you have a little bit of this, like blood flow to it. You have some cholesterol plaquing in there. You have some viscous material in there, and it kind of it'll break through. So I'm drawing an arrow. The blood catches it right here, and this part will break off. That's called unstable plaquing. That's where most of the heart attacks occur. And there is a solution for that, though. Horse chestnut is an herb that can help with that. And I have a complex of herbs. It's called Horse Chestnut Complex from MediHerb. That's one of our other favorite companies. And that will solidify the plaquing and make it more stable so it doesn't break free. So I have another video on clogged arteries, and there is a cause for this, and there's a solution for that. And the name of the video is How to Unblock Cholesterol Plaqued Arteries. It's on YouTube. Maybe it's to your right on the right side of the screen. But if you search for that, you'll find that. It's a 20-minute video more information on clogged arteries. So the point of this video is these 4 tests right here. I just want to bring this to light because it's not talked about at hospitals. Medical doctors don't talk about it, and but they exist, they're available, and if you have any heart condition, you need to get these run. If you have any symptom of pain, maybe it goes through to your back, shortness of breath, tightness here, left arm, jaw, even if you haven't told anybody about it, you have got to get these 4 tests run. And I have a patient with a normal cholesterol his whole life. He's 69 years old, and in the last couple of years he's had a few episodes that last 1 minute of this pain that goes down. It's happened 5 times in 2 years. And guess what? It was this one. This showed up, and he had some inflammation caused by bacteria, and now we're addressing it, and this will be the fix for him. It didn't show up with LDL, cholesterol, triglycerides. Even though he's had those blood tests run every year, basically his whole life, it was this one that I had to run because the medical doctors, they don't know about it, or they're not running it. They just refuse. I don't know. I don't get it. If I was an MD, I'd be running this on all my heart patients. But as a chiropractor, I'm running them on my heart patients anyways. So if you need more information from us, you can check out our website. You can get it, an email that way, and contact us through the website. All right, take care.
This is a list of diseases commonly found here and in populations that eat and live like the U.S., but were rare or even non-existent in populations eating diets centered around whole plant foods. These are among our most common diseases, like obesity, hiatal hernia, one of the most common stomach problems, hemorrhoids, and varicose veins, the most common venous problems, colorectal cancer, the number 2 cause of cancer death, diverticulosis, the number 1 disease of the intestine, appendicitis, the number 1 cause of emergency abdominal surgery, gallbladder disease, the number 1 cause for non-emergency abdominal surgery, and ischemic heart disease, the commonest cause of death here, but a rarity in plant-based populations. This landmark study suggesting that coronary heart disease was practically non-existent among those eating traditional plant-based diets in Africa claimed that there was adequate autopsy evidence to confirm that fact. Let's look at it. Doctors in sub-Saharan Africa during the 30s and 40s recognized that certain diseases commonly met in Western communities were rare in rural African peasants. This hearsay talk greeted any new doctor on arrival in Africa. Even a teaching manual stated that diabetes, coronary heart disease, appendicitis, peptic ulcers, gallstones, hemorrhoids, and constipation were rare in African blacks who eat foods that contain many skins and fibers, such as beans and corn, and effortlessly pass a bulky stool 2 or 3 times a day. Surgeons noticed that the common acute abdominal emergencies like appendicitis in Western communities were virtually absent in rural African peasants. But do we have hard data to back that up? Yes. Major autopsy series were performed, first 1,000 Kenyan autopsies, not a single case of appendicitis, not a single heart attack. 3 diabetics out of 1,000, 1 peptic ulcer, no gallstones, and no evidence of high blood pressure, which alone affects 1 out of 3 Americans. Maybe the Africans were just dying early of other diseases and so never lived long enough to get heart disease? No. Here's age-matched heart attack rates in Uganda versus St. Louis. Out of 632 autopsies in Uganda, 1 myocardial infarction. Out of 632 Missourians, same age and gender distribution, 136 myocardial infarctions, right? More than 100 times the rate of our number 1 killer. In fact, they were so blown away, they did another 800 autopsies in Uganda, and still, just that 1 small-healed infarct, meaning it wasn't even the cause of death, out of 1,427 patients, less than 1 in 1,000, whereas in the U.S., it's an epidemic. How do the doctors even know what to look for over there, then? Though practically unheard of among the native population, the physicians are quite familiar with heart disease, because of all the folks that immigrate to the countries in Africa. The famous surgeon, Dr. Burkitt, insisted that modern medicine is going about it all wrong. A highly unacceptable fact that is rarely considered yet indisputable is that with rare exceptions there is no evidence that the incidence of any disease was ever reduced by treatment. Improved therapies may reduce mortality, but may not reduce the incidence of the disease. Right? Understand what he's saying? Take cancer, for example. The vast majority of effort is devoted to advances in treatment. Second priority given to screening programs attempting early diagnosis. But is there any evidence that the incidence of any form of cancer has ever been reduced by improved treatment or early detection? Early diagnosis may reduce mortality rates, and medical services can certainly profoundly benefit sick people, but have little, if any, effect on the number of people becoming ill in the first place. No matter how fancy heart disease surgery gets, it's never going to reduce the number of people falling victim to the disease. He compares it to an engine left out in the rain. Right? If an engine repeatedly stops as a consequence of being exposed to the elements, it is of limited value to rely on the aid of mechanics to detect and remedy the fault. Examination of all engines would reveal that those out in the rain were stopping, but those under cover were running well, so the correct approach would then be to provide protection from the offending environment. However, considering the failing engine as the ailing patient, this is seldom the priority of modern medicine. He sums it up with the cliff or the ambulance. If people are falling over the edge of a cliff and sustaining injuries, the problem could be dealt with by stationing ambulances at the bottom or erecting a fence at the top. Unfortunately, we put way too much effort into the provision of ambulances and far too little into the simple approach of erecting fences. And then, of course, there are all the industries enticing people to the edge and profiting from pushing people off.